It's interesting to think about our aging community right now because California is facing for the first time in its history the reality that more of our community will be over age 60 by 2030. That does not feel like it's close. It is. So if you think about walking down the street and 8 out of 10 people you walk by are 60 plus years of age, you begin to understand the impact of what we are facing as a community, especially in our Northern Territory. It is something that we want to seriously look at and consider the PACE program as a possible solution where you have individuals now being well cared for in their own home, in a safe place where they can prosper and thrive. Mental health for any age can be challenging. Loneliness sets in. That's a very dangerous place to be emotionally when you already physically do not feel well. So to have access to support, to have access to social activity is critical. The mind is the driver. The heart and the mind are the drivers for good, solid health care.
It was nice to be in the center when I was visiting and see ambulatory seniors just come in and just have lunch. And they had people read them the newspaper because, their eyesight's not that great anymore. They could sit and chat with their friends. They had like card tables out. They could socialize. They had a group of people. And then when it came time to pick up their grandchildren, they'd leave to go pick up their grandchildren. They would transport my mother from my sister's house to the center every day, so that she could attend her appointments, so she can do her physical therapy. At first, she didn't want to go every day, so she says, I'll just go 3 days a week. So we let her choose, and that they were so flexible in allowing her to kind of dictate how much she wanted the PACE Center to be involved. It relieved us from a lot of the burden of having to quit our jobs, right? We made decisions together. And at first, I think I felt guilty for reaching out to the PACE Center, right? Because deep down in my heart, it was like, oh, my mom is aging, but we also knew this would be the best thing for her. We needed a partner in our community.
My name is Brandon Thornock, and I am the CEO of Shasta Community Health Center. Here at Shasta Community Health Center, we can see the need for a PACE Center in our community. Our dream is to make this a reality by building a center that would provide medical services, occupational and physical therapy, diet and nutrition services, chiropractic services, case management, mental and behavioral health services, dental services, specialty care, all sorts of services that this population could really take advantage of and need in their day-to-day care. The center's sole purpose is to help older adults live their happiest, healthiest lives possible. In addition, we would provide transportation to and from the PACE Center for those who need it. The center would also provide meals and a variety of recreational activities, including gardening, classes and workshops, enabling participants to engage and build social connections. We believe this is what medicine should be. Our desire is to build a new 18 to 20,000 square foot PACE Center on property we own on Churn Creek Road in Redding. We believe that this will provide a much needed resource for our community.